Hello, Dr. Wadle here. Today we're going to go over some homework. In this office we consider them the brushing and flossing of your spine. Just like your teeth, you want to take very good care of it. The bad thing with the spine is unlike teeth, you can't just pull one out and put a spacer in. You cannot replace it, so we have to take exceptionally good care of it. So we're going to start with the foam roller. Okay, with the foam roller, there are actually 4 exercises. Take the foam roller, place it on the floor. For the first one, I'm going to scrub or treat the thoracic and upper thoracic spine. Okay, now when you do this, you only want to cover, 10 inches to a foot region. So get comfortably on the floor, cross your arms over the roller, and then scrub back and forth. Okay, you want to do this on a daily basis, just like brushing your teeth. Scrub up and down. And what that does is helps those joints move and put some motion in them, and helps gently massage those muscles also. So this is for the upper, mid, and lower thoracic. To move up higher, go ahead and cross your hands behind your neck. Flare those elbows out, and what that will do is block so you won't fall off the end. And again, about 10 to 12 inches of scrubbing. Move up a little bit higher. And for each one of these, you do 10, 15, 20 passes every day, morning or afternoon, evening, whatever works best for you. So scrub those areas really good. So that's the second area. Now to move to the lower back, sit on the foam roller and then do the old crab walk like you did when you were younger. And then just walk down till it slides down on your lower back or your lumbar spine. And scrub that area out also. Again, 10, 15, 20 passes every day. This is going to feel very awkward at first, but as you get used to it, it will become more natural. And then the last one is you want to lay it on the floor and then become parallel with it. So sit down on the edge of it, lay back on the foam roller, make L's out of your arms, and just let those drop back and really stretch out those muscles on the front of your chest. Today's world is all anterior, we're reaching. So with this, what it will do is really feel good and stretch out those muscles. Do this for 1-2 minutes at least, and you can extend it to 3, 4, 5 minutes as desired. For an advanced move, you can slide off and let your head drop off the end and actually stretch out those neck muscles. Again, be sure to include these in your daily routine to keep your spine fit. Next up are the yoga balls. The yoga balls come in an awesome little pouch that allows you some variances in how it holds the balls. You want to spread them apart, so loosen the top till they spread apart. What you're going to do with these are place them on either side of the spine. Okay? Find a nice flat area. The wall, let's start out with the wall. You can advance to the floor, but let's start out with the wall. Make sure there are no obstructions on the wall or nothing in the way to trip you up. So again, place it on either side of the spine. Get a good broad foot base, lean up against them, and then just scrub up and down. Now the area you're covering on this is very small. You might even get in there and just find those pressure points and just really get in there and work that pain out of there or that stress out of there. Or just scrub it. How long do you do this for? 1 or 2 minutes is fine. So that's the yoga balls against the wall. Okay, next with the yoga ball is we want to remove one yoga ball from the package. Take that yoga ball, find an outside corner of the wall. What you want to do is for those areas up in here, it's hard to get to on a flat space. So what we do is place the ball on top of that trap muscle or that shoulder muscle. Put it against the wall. Again, get a good broad base. Get your lower back or your back nearly parallel to the floor and get in there and really work in on that muscle. This will feel really good. You'll find those really sore spots, but it's a good hurt type thing. Again, do this to tolerance. If it's painful, don't do it. But discomfort is okay. So get in there and work that. Again, work it for 30 seconds to 2 minutes. And then for the neck, again, use that outside corner. What you want to do with the neck is hold it up against the neck, pin that ball against the wall, and just work those neck muscles too. Again, get in there and work to tolerance. Discomfort's okay, pain is not. Work that, get that tension out of that muscle. And those are the yoga ball exercises. If you have any questions, just let us know. The next tool we have in our tool belt to help you at home is the seat disc. It is like the wobble chair you do in the office, but this is a home version of it. What you want to do is find a flat chair with a hard surface. Place the seat disc on the chair, and then you wobble just as you would do in that office. Sit down on the disc. If you need an armchair, use an armchair. But the exercises you want to do, again, are side to side. Pivot those hips. What you're doing is actually pivoting right at those lower joints, getting those lower joints lubricated, warmed up, and moving. Side to side. Do 25 of those. Again, don't do it into pain. Discomfort's all right. That tightness, discomfort, that's okay. But do not do it into pain. If you're going to the side and it really hurts, don't go to that side. So we're going side to side and then front to back. Okay, if you want to accentuate that, drop your head forward and back, you can do that also. But again, do this to comfort. Again, it's like riding a bicycle. It'll be a little difficult at first or a little uncomfortable at first, but you'll get really good at it. So we've done side to side, front to back. Now we want to do circles or semicircles. So go to the side. Again, keep that head neutral. Pivot those hips side to side. Again, 25 of those would be great every single day. Again, do these to tolerance. Discomfort's okay, pain is not. And that's the seat disc. A lot of people are curious about what you're actually trying to do with the seat disc. Let's dig into this a little bit deeper. Okay, so the seat disc, what you're actually trying to do is work the lower spine. Okay, so on the seat disc, when you go side to side, if you can see that, you're actually pivoting that pelvis and mobilizing or moving those lower vertebrae and discs. What you're doing is help rehydrate those, you're helping warm them up, you're helping to push that inflammation out of there. So side to side, you can just see how that's working those discs. Now from looking straight on, same thing. Side to side, what you're actually trying to do is focus on those lower discs, put some motion in those joints. Again, to warm them out, push that inflammation out of there, help get those good nutrients into this disc because they have horrible circulation, so you want to get the nutrients in and push the waste out of them. Now the front and back, again, what you're doing is hydrating those discs, getting that good nutrition in, getting those waste out. And then circulating or the circular motion, again, you're getting those discs moving. If you have any questions, just let us know.